This hearing is now resumed. The chair recognizes Councilmember Jeffrey J. Young.
Thank you, Mr. President. The first line of questions are going to be devoted toward the Department of Public Health. In the Philly Joy Bank program, is it possible that you can provide us with data on income levels of the participants, the zip codes of the participants, and the amounts distributed to date? Also, if you could provide us with who will be doing the assessment to see if this particular program has ultimately achieved the goals that we're trying to achieve. And I say that to say, because a guaranteed income is great in theory, but if we are really trying to target a population that is experiencing these health issues, I do think that we should, the spending of the money should be targeted more toward those things that are going to directly affect that outcome. So I just want to, keep that in mind as we're going through this program. $1,000, sounds good until they spend that $1,000 on things that ultimately contribute to the negative health outcomes that they were experiencing in the first place. So if we can keep that in mind. Second question is related to, it's a non-budgetary question. I'm sorry, I'm going off task. But the regulations regarding the tobacco retailer permit here in the city of Philadelphia, in 2022, I believe the regulations were changed to state that no new licenses will be able to be within 500 feet of schools grades K through 12. Now, in a prior life, I represented a corner store whose her father died, and she inherited that store. And when it was time to renew her cigarette or tobacco retailer license, she was denied that license because she was considered to be a new owner, although she inherited that store from her father. And that license was kind of like the backbone of that store that's been in that particular neighborhood in Fishtown for almost 30, 40 years with no issues. And so can you just explain the premise of this regulation and why, if a property was already exempt, why does now this new owner cannot apply for a license, particularly in this case where she inherited a business from her family, a business that she has worked in since she was a kid? Why is it now that she is unable to continue to sell a product, a legal product that store has been selling for over 40 years?
Thank you for your questions, Councilman. For the first line of question, I'm going to have Dr. Stacy Callum respond, and for the second line, I will have Dr. Pollock Ravel Nelson.
Thank you.
Hello, I'm Dr. Stacy Callum, Director of Maternal Child Family Health Division. I'm going to try to speak more slowly this time so people understand me. So the program hasn't launched yet. The Philly Joy Bank will be launching tentatively June 22nd of this year, so in a month and a half. I think one of your questions was about who's eligible. So it's folks who live in one of the 3 neighborhoods in Philadelphia that have the highest rates of very low birth weight births. So that's Cobbs Creek, Nicetown, Tioga.
And Strawberry Mansion.
And Strawberry,
I'm concerned,
thank you.
Yeah, and it's folks that are making up to $100,000, right? So the question is, again, I just want to make sure that we're clear on when we're collecting the data. Can you provide us, that's why I said, can you provide us with the income data of the participants, their zip codes, again, the amounts that's distributed per zip code, and also, what else I asked for? Yeah, that was it. So we can then determine, and also tell us who is evaluating that data to determine if it is going to be meeting the goals of what the health department has.
Yep, so for evaluation, we did an RFP and we selected researchers from Drexel University from their School of Public Health who will be doing our evaluation. We don't have the program data yet, right, because we haven't actually started, so no one's enrolled. But I can tell you about the neighborhoods we're serving. The median household income is between 20 to 30K per year, so we expect most participants to be around there.
No, I'm familiar with that, but again, your program states that it's folks that are making up to $100,000. So I want to make sure that, how can we, or how are we targeting the participants, right? Because if you target folks that are mostly close to that $100,000 level, then the outcomes that we're expecting are probably, the health outcomes are probably a little bit different than folks that are, living in poverty in the city. So again, how do you target the participants?
Yeah, so we're going to be recruiting in a few different ways. So really relying on trusted messengers in those neighborhoods. So prenatal care providers at our health centers, at other prenatal care establishments, WIC, home visitors. So really folks that are in the neighborhood and trusted is where people who are pregnant might be, is who will be doing a lot of the outreach and recruitment for the program.
And what was the determination of that income, the income level, the $100,000?
Yep. So that's actually based on community feedback. So we partnered with researchers from CHOP Policy Lab and did formative research where we did community focus groups of Black Philadelphians who'd recently given birth or who were pregnant about the Philly Joy Bank and how should we make all of our design decisions. And one of the big points of feedback we got from community is to make sure we tie eligibility not just to the federal poverty line or Medicaid eligibility, but really thinking about those Philadelphians who maybe make too much to qualify for traditional public benefits but aren't yet making enough to thrive. So we looked at a living wage calculator, and that's where we came up with the $100,000 sort of cap. But again, knowing the neighborhoods that we're focusing on, we don't expect many people to be in that range.
Okay, so if you don't expect that, then why create that, I guess, that artificial kind of like cap then if you don't expect it? You should set the cap at what your expectations are.
Yeah, we were really trying to be responsive to the community feedback, which they told us to set it higher than sort of a traditional federal poverty level.
Okay, thank you, I appreciate that. And then the question regarding the tobacco retailer license and the 500 feet from K-12 schools.
Sure.
Essentially, again, the rationale is, the premise of my question is because I had a client whose father owned a store that she inherited, and then at the end of the year, she had to apply for a license and was denied. And I'm just saying, if the goals are to, decrease, tobacco use, I understand that, but this particular property has already had tobacco use, tobacco sales for almost 40 years. In that particular neighborhood, it doesn't create any kind of new disparity or new issues because they've already been there. So if you can elaborate on that.
Sure. And I just want to clarify for the record, it's a tobacco permit. I don't want to confuse it. It's a tobacco permit, not a license.
Thank you.
And tobacco permits are not transferable. So the permit is associated with the person and the establishment. So it's similar to a driver's license or a liquor control license. It's issued to the person and the establishment, and it's non-transferable. So that's what ended up happening with the person that you were representing. It's not transferable, and then they probably, and I don't know the address, so I don't have the details, but I'd be happy to follow up if you provide the address. But since it's not transferable, and if it's in a cap, which was legislation to prevent youth tobacco access. So there shouldn't be tobacco stores in it. We want to make sure that the poorest of our neighborhoods are not saturated with tobacco retailers. So if she's in a cap or he's in a cap, then they wouldn't be able to get the permit.
So I can tell you that this isn't, I guess at one point it might have been, but this isn't Fishtown, right? Where there's no issues with income or low income folks or whatnot. So I made the argument we appealed, and I made the argument at the board. Only one person on the board who was actually a lawyer understood my argument, but everyone else turned it down. But I just say that to say that, we think we really need to take a look at our systems because it is prohibiting small businesses from operating in our city. And I don't think we want to prohibit small businesses from operating who've been operating in our city for years with no issues whatsoever. And so I think we should look at our regulations to make sure that our regulations are meeting today's standards and today's needs, particularly in those particular neighborhoods. And I heard the bell, so thank you.
Thank you. Thank you so much, Councilmember Young. We will now move to Councilmember Phillips. The chair recognizes Councilmember Anthony Phillips.
Thank you, Majority Leader, Councilwoman Captain Gilmore Richardson. I just quick rapid fire questions for the Department of Behavioral Health. There's a waiting list of children and families for services. How big is that waiting list?
So I don't have that directly, but I have to say that the services are embedded in the schools. And
Right.
so there really shouldn't be a waiting list to be able to get access to treatment. There's providers right there in the schools. They can tap into a whole array of specialties depending on what the needs are of the kids. And there's also prevention providers. So are we talking about people just calling to sort of separately get, well, we also have expanded our PACS program, which is very trauma focused for the kids. It's like, there's now
No,
25.
I just wanted to make sure there was enough providers to be able to serve our children in those schools. So
Okay,
if there's
so
not a waiting list,
I'm
that's
getting no waiting list. So what I'm
perfect.
concerned about, though, if you hear that there's a waiting list, again, that concerns us. So we want to
Gotcha.
make sure that they call member services because there should not be a waiting list for kids.
Okay, great. Providers should be delivering intensive behavioral health services year-round in the home and in the community settings when not in schools. What does intensive behavioral health services utilization look like in the summer months? And are families being engaged? As well as, in what way is DBHIDS and DHS providing services for delinquent and dependent children?
So IBHS is year-round. They are in the schools, whether they're summer school. They are at the homes or in the community. So they do maintain connection with people kids who have met those criteria. And also remember, these are providers that are also in the community. IBHS is always in the community, in the home and community. Thank you, which is what I was saying.
Can you provide data around academic improvement of the kids who receive these services?
So So I don't know that we have that. We can talk to our school our school partners, but IBHS is a tier 3 service, just so I am clear on that.
Yeah.
The school does have services for universal, tier 2, they have school counselors, they're even a provider for CBH in the STEP space. But IBHS is a tier 3, so it's folks that are really struggling with, need a certain level of treatment. So do not know for those kids whether the academic, and it's not necessarily going to be something that can be seen short. It might require like longitudinal data. So I'll get you the answer to that to know to what extent they're tracking it, but I think it would be the school system that is going to have that data. But they are partners with us, so we can check that out.
Thank you, Dr. Bowen. Thank you, Majority Leader. That's my time. I'm good. Thank you.
Thank you, Councilmember Phillips. The chair now recognizes Councilmember Nina Ahmad.
Thank you, Majority Leader. So a few other questions. One was about the relationship of DBHI with the gun violence prevention programs, and if you worked on their cognitive behavioral therapy support that we were told they now include in their programming.
You're talking about cognitive behavioral treatment.
Correct.
We have cognitive behavioral treatment infused into a great deal of the work that we do to real evidence-based practice. So when we talk about gun violence, we always talk about trauma, right? Because trauma leads to gun violence. It also is the result of gun violence. So we're very, very trauma-focused. And therefore, the PACS, which is the Philadelphia Alliance for Children Trauma Services, right? And is a very intensive trauma-focused cognitive behavioral therapy. So we have trained a whole bunch more providers so that they have those particular skills. And we have expanded the network of PACS providers within the city, and it's across the city, everywhere in the city. So we have cognitive behavioral therapy infused into the work that we do with the kids throughout, and also the school, training the folks in the school.
So actually my question was about the actual programs that are doing anti-violence work. Is your department intersecting with them? You know, these are the grassroots folks who are on the ground doing, violence interrupters, all of those different
Right.
smaller groups, not the school district or the bigger
So we're
entities.
involved with, so we support EMER, Mothers in Charge, Black Men Heal, and they are engaged with us on a number of initiatives, like one that's called From Trauma to Triumph. It's a list of those folks who are providing the services to the kids, and it's meant to be preventative from going down the gun violence road. And it actually came out, the types of programs that are being offered by the community-based organizations that are focused on gun violence is based on the work of the external stakeholders around former perpetrators of gun violence,
Right.
and what was going on in their early lives, and how can we prevent that happening for the kids that are currently.
Right, so my question is really that, yes, you do work with them, and do you have data to show over time that your involvement with these CBOs have done what? Have you collected information around that?
So we'll get you whatever information that we have. The initiative that I just told you about is a newer one that is standing up, but we do support, we have supported for some time, Healing Hurt People, Cure Violence, Ceasefire. So we are funders of theirs, and we do have data there.
Okay, because I just want to see how embedded CBT or other things of that nature are each of these programs, because it is abundantly clear that we need it. And so I wanted to see if there's a comprehensive policy around all anti-gun violence work from the city of Philadelphia that gets funding of any sort, whether DBHI is connected or connects to providers who do that. So I just wanted data around that, how many
We can get you
are
that.
getting it, yeah.
But
okay.
sometimes there might be an initiative where they have a grant that they bring in a provider there. Often they're also part of the network, and so in a sense we are part of what they're doing there, but sometimes it's not necessarily like we have the data for that particular program, but we'll get you what we have.
Yeah, I
Dr.
just
Bone-
want to be a collective place where we get all this information.
Understood.
And your department seems to be the most appropriate place, whether or not
And we
you're
collect
giving
a lot of
directs.
data.
Yeah, so we need a report to say we've done this, this happened in
Okay.
1 year, 2 year, this is good, this is bad, how do we move? That's all.
Got it.
Okay.
All right, thank you. Thank you, Mr. President, or Madam Chair.
Thank you. Thank you so much, Councilmember Ahmad. The chair now recognizes Councilmember O'Rourke.
Thank you, Madam Chair. It's Black Maternal Health Week in the Commonwealth. So I want to highlight that of the top 10 most populated, of the top 10 most populated United States cities, Philadelphia has the highest rate of infant mortality in the first year of life. And when we look even closer to race and ethnicity, Black infants in our city are over 4 times more likely to die before their first birthday than white infants. This is a crisis, but we do know how to solve it. And when we design solutions that see the whole person and the barriers that they face, we can achieve true success. And the Philly Joy Bank pilot program is exactly the kind of response that I believe that we need. So I share Dr. Ahmed's excitement about the program launching in June. I want to thank all those who have put in work there. Just wanted to ask for it to be stated on the record clearly. Can someone just speak to some of the common impacts of guaranteed income programs in general, just so we can state on the record for this portion, please?
Thank you, Councilmember.
Thank you.
Go back to Dr. Stacy.
Hello. Good to see you.
Nice to see you, and thank you so much for your enthusiasm and for the question. So as far as guaranteed income...
Pardon me, please state your name
Oh, I'm
for
so
the
sorry.
record and speak directly into the microphone. Thank you.
I'm Dr. Stacy Callum, Director of Maternal Child Family Health at the Philadelphia Department of Public Health. So thank you so much for the question. As far as guaranteed income and its impacts on birth outcomes, A lot of what we know comes from Canada, actually, from a program called the Healthy Baby Prenatal Benefit, which gives low-income pregnant people in Manitoba, Canada, unconditional cash, and it found that it reduced rates of low birth weight by 17.5% and reduced rates of prematurity by 21%. So that is amazing and something we're really excited about. And then here in the US, we know that states that have an earned income tax credit, and then also during COVID, during the expanded child tax credit. So not guaranteed incomes per se, but both ways of giving more cash to people during pregnancy, also decrease the rates of prematurity and decrease the rates of low birth weight.
We thank you for your work on this, Dr. Callum, and all those who have gone into it. Look forward to helping to slash those maternity rates for sure. I want to turn my focus to Department of Behavioral Health and Intellectual Disability Services. In the aftermath of the deaths of Christian Hall and Walter Wallace, it was abundantly clear that as a city, we needed to rethink how we respond to people in crisis. Deeply heartened, super excited about DBHIDS's plans to continue and expand the Philadelphia Community Mobile Crisis Response Teams. These teams send medical professionals to those who are in crisis, and they free up other resources like the police to focus on other issues that they may be better trained for. Last budget cycle, thanks to the efforts of a number of council members, including Minority Leader Brooks, Councilman Jones, Councilman Squilla, sorry if the bell is going, I'm going to just finish this up, Council President Johnson, Councilwoman Gautier, past Councilwoman Vaughn, as well as Councilman Driscoll. An additional $3 million was added to this important work. Can you tell us how the additional $3 million actually aided your work that was secured by those members?
Yes, that was specifically to build the bridge teams so that we can address the response rate. So that has been this past year, building up those teams and getting them ready to hit the streets. So it's specifically what it was meant to do is what it was used to do. So bridge teams, that's what that part was about.
Thank you very much. Madam Chair, is there a round two?
Yes, there will be a round two, time permitting.
Time permitting, yes, ma'am.
So we'll get through the first round as quickly as we can.
Okay.
Okay, is that good for you, Councilmember O'Rourke?
I have some more for round two if time permits.
Excellent. Just please get in the queue.
Yep.
The chair now recognizes Councilmember Harity.
Thank you, Leader. So just checking these numbers. So you said right now, out of 1,000 or so beds that we have, there's about 175 available? I believe that was the number you said.
109. The SUD beds, there's 109 available today.
109 available, okay. That's not even, all right. So, and the number that you're saying of homeless addicted out in Kensington is about 675, you're saying?
The number that have been encountered or with
Right.
by, yes, is 675. And like I said, that now is publicly available data.
Okay, do you have, so what happens if we say send you 300 people in a day? What would you do then?
So first I want to say that when you say send us,
Well, we're about to start
yes,
doing the mayor's plan, and
Right.
we're planning on the AMP program and the PAD program, and I would imagine that during that process, you're going to have some very high numbers of people that are going to be needing to be put somewhere. I'd just like to know with 109 beds, how you plan on doing that.
Okay, so first of all, we are part of and engaging alongside the many agencies that are involved in this work. We are engaging folks even, every day, even today. We have not only the capacity, we also have overflow beds. We are prepared for a surge, but we're also really looking at the rest of the continuum because we also have slots available there. So it really depends on what they need. Do they need outpatient and some form of housing? Do they need a bed-based
I could tell you
treatment?
right now that none of these people need outpatient program. They all need inpatient program. There's no way they'll be able to stay sober on an outpatient program going back to the place that they came from. That's just outrageous to even think that somebody that is on this type of drug is
No, I'm
going
not
to be
saying that
able
for the
to
first-
go to an
So
outpatient
let's
program
not,
and
right,
get the help
because
that
what
they
I'm
need.
saying is that people, I'm so sorry. I'm so sorry, but I didn't mean to imply that they wouldn't be coming first in there. I was just talking about the whole continuum. We do have the capacity right now with empty beds, but also if you're saying that 675 are going to come in and 109 are available, we also have our overflow plan, okay? So that we have out-of-network capacity.
Well, how many beds are in the overflow plan?
And we also have an open network, by the way, where providers are coming in like
Right, things just
regularly.
keep changing as we go along, I guess. You're just putting it out there as a...
Do we have an answer to how many the overflow can handle? Okay, we'll get that to you, okay? We'll
And
get that
pardon
to you.
me, I'd like to request that you get the information for Councilmember Harity and submit that information to our council president
Sure.
for dissemination to all members of council.
Absolutely.
Okay?
Thank you.
Is that
Will
good for you,
do.
Councilmember Harity? Okay, excellent. The chair now recognizes Councilmember Landau.
Thank you. Well, I was going to start with the overflow beds as well. And so we're going to get the number of beds that we have available. Can you tell us the organizations that are part of this collective plan?
I don't have that off the top of my head, but there are a number of providers. I mean, it's nearly 200 providers in the network, so there are those who, and that's across the board. But we'll definitely get you how many are in this overflow plan, and also the providers who currently are in network that have the ability to expand, and that the open network will also be helpful to us in bringing others in.
Can you also let us know, again, I will submit the questions I asked earlier, but how long can they stay in these treatment programs, and what kind of follow-up are we doing after they leave?
Okay, so the follow-up is really what I was trying to also convey to Councilmember Harrod. That's what I was trying to convey, because it's more than just the time that they're in that one level of care. It has to be the goal is long-term recovery, right? Whole person health, long-term recovery is the goal. And when you see that work, it's fantastic, right? People do recover, people do, treatment works, right? But how long they can stay at that level of care depends on how they're doing, right? It's a medical necessity, that's a requirement. So different people stay for different periods of time in treatment.
So I'm going to transition over to health because that buzzer's going to go off any second now. But the biggest concern we all have is long-term housing, obviously. They're going to leave treatment, be expected that they can maintain through outpatient. We have to have housing associated with this for people to.
Agreed. Because anyone who goes into treatment, goes back out on the street, will invariably fail. I mean, it's just, it's right. In order to succeed in treatment, you need to have stable housing.
Right, okay. Question for health. A 2019 study found that between 1993 and 2002, 10,592 cases of HIV were avoided because of access to clean syringes. The same study multiplied that number by the average cost of HIV treatment for a lifetime, which is $230,000. That's at $2.4 billion over 10 years, or roughly $240 million annually. That was from a WHYY report. So my question is, if city funding to support the purchase of syringes for syringe exchange is eliminated, what will be the impact on HIV transmission in Philadelphia? And what is the impact on transmission of hepatitis C? And my follow-up, to put it out there now, what are the alternative plans to keep transmission rates of HIV and hepatitis C low? What resources are necessary to treat these additional cases?
Thank you, Council Member. I'm going to respond to your question, then allow my Director of HIV Health, just in case she has additional information. You're correct. In alignment with that study, the absence of syringes can lead to increased rates of infectious disease such as HIV and hepatitis C. As well as many other studies that cited that. Our goal is to sort of work with other partners and find alternative sources to support and prevent that. In the interim, we are clear and probably anticipate that there may be some spikes. So we have plans for that, and I'm going to turn over to Dr. Kathleen Brady.
Good afternoon. My name is Dr. Kathleen Brady. I'm the director of the Division of HIV Health at the Philadelphia Department of Public Health. And so, first, let me just want to give some background regarding syringe exchange. Syringe exchange is evidence-based and the most cost-effective public health intervention in the history of the HIV epidemic. Support of syringe exchange is a required activity for the health department's CDC HIV prevention funding, and the sole purpose of syringe exchange is to prevent transmission of HIV, hepatitis B, hepatitis C, and other infectious illnesses spread through sharing or reuse of syringes. It does not increase injection drug use or the presence of syringe litter or crime, but it has the added benefits of linking people who inject drugs to substance use disorder treatment, prevention and overdose through distribution of naloxone and fentanyl, and xylazine test strips, safe disposal of syringes and injection equipment, and vaccination, testing, and linkage to prevention, care, and treatment for infectious diseases. Do we expect an increase with withdrawal of city funding for syringe exchange? Absolutely. Philadelphia has been experiencing an ongoing HIV outbreak in people who inject drugs since 2018. And this outbreak occurred despite having an active syringe exchange program since 1992. Why? There are multiple reasons, but the main one is related to fentanyl infusion into the drug supply. Obviously, fentanyl is a potent, highly addictive, but short-acting opioid. In people who inject drugs, this resulted in increased frequency of injection, and unfortunately, the demand for clean syringes was greater than the demand, which resulted in increased sharing and reuse of syringes, and resulting in transmission of HIV, hepatitis B, and hepatitis C. And as part of Philadelphia's public health response, the city actually increased the budget for syringes in fiscal year 2019 and fiscal year 20. Syringe exchange increased, as did syringe coverage, so that more people who inject drugs had a sterile syringe for each injection. And for syringe exchange to be effective, there needs to be reliable but flexible funding. The philanthropic landscape in Philadelphia is neither. Go ahead. Okay. Keep going?
No, answer.
Yep, okay, keep going. And so we expect that basically philanthropic and private donations for syringe exchange will not meet the budget that is currently in the city budget for fiscal year 24, which is $900,000. And so, yeah, that's basically what we expect, is that there will be decreased syringe distribution and increase in HIV cases as a result.
So just a really quick follow-up to that. So that's $900,000 that has been in the syringe exchange budget.
Yeah, no. It's $900,000, but $654,000 of that $900,000 goes towards the purchases of syringes and other paraphernalia. The remainder of the budget goes towards other supplies like needle boxes, et cetera.
Okay.
That's time.
Thank you.
You're welcome. The chair recognizes Councilmember Ketty Lozada.
Thank you, Council President. Just along those same lines, I mean, I had questions as well as my colleagues did about overflow beds. And so let me just stay there for 1 second. You mentioned that there's 200 providers, Dr. Bowen, that have these beds. Can you please provide this body with a list of who those providers are, how many beds each of them has, how much each of them is paid per bed, because there's also all kind of numbers thrown around for different types of beds at different types of cost per night. So if you could share with us a list of who they are.
So we'll get you whatever we can get you, but let me just clarify. When I said 200 providers, that's like across the whole network. That includes like mental health and also.
Let me finish my question,
Okay.
then you can respond to that, because I don't want the clock to
Okay,
get me.
okay.
I also want to know, do these beds overlap, do the providers overlap with other city departments who also have certain beds in their inventory, such as OHS, right? So do you guys have beds that OHS has beds and they come from the same provider, or are they considered to be the same bed or not?
We're talking about treatment beds. That's not OHS, right? So that's us if we're talking about treatment, billable treatment. If we're talking.
I get that, but
Yeah.
are there providers that have, for instance, ABC company has substance beds, and then ABC company also has, gives OHS access to
There
other
is some
types of-
fluidity with, let's say, commercial insurance, right? So there may be some, right? Because we don't own the beds, but we know that we have a certain number of them. So that's how we can get our slots, right? But it's not every bed that they have that will be a bed that DBH, IDS, or CBH uses.
Council President, can we ask for a list of a list of providers that have these beds from DBH, IDS, as well as from OHS and other city entities? Who are the providers? How much are these beds? And how many do they have?
Okay, so treatment beds would be us, not OHS. If we're talking about the support services around the treatment, then yeah, okay, so then we might be in that place, but there is very specific for behavioral health kinds of programs. I also want to just clarify that when we talk about, I mean, I was answering the question of Councilmember Harity and others from the DBH IDS only perspective, and we're really part of a bigger operation that's going on right now with the triage and wellness, which will help with having more beds available than just what DBH IDS can do on its own.
Thank you. You guys have different providers that you work with on the ground. It's no secret that community residents in Kensington have had very serious concern with some of your providers. Is there a process for which the community can voice their concerns to DBH IDS about specific providers? And if yes, what is that process? Also, does DBH IDS, I think I heard you earlier mention an advisory group. What's the role of the advisory group? Who's in the advisory group? And is there community members in that advisory group, and what is their role?
Yeah, so the advisory board for DBH IDS is made up of multiple stakeholders, right? So it's people with lived experience, it's providers, it's advocates. So yes,
I didn't hear you say community members.
Community members, right? It's a mix, and I think I may have seen some folks who is part of that provider, but there's, yes, and it's intentionally meant to be really an advisory board. So it is meant for folks to bring concerns, to help address concerns, to think about strategy. So it's an advisory board.
Can you please provide this body with a list of who your advisory board members are and what their role is as well?
Sure, and I had mentioned the treatment trauma group. We have representation in there from that group. So it's meant to be, to advise the department from the community perspective. But we also go out to the community. We have been doing tech tours, which we get invited in by the community. We talk about the services that we have, the issues that folks have, and that's at a pretty high level, tech tour, because we also have folks who, like the Community Wellness Engagement Unit, that goes to town hall meetings or to schools or to places of worship and engages with the community as well.
That's time. Thank you very much. Just please provide the information to the chair, members of the board.
Absolutely, we'll do. Oh, I'm turning to her. Yes, we'll do.
All right, thank you very much. The chair recognizes Councilwoman Catherine Gilmore Richardson.
Thank you. Thank you so much, Mr. President, and thank you, Councilmember Lozada, for that line of questioning. I'll start with health and then end with DBHIDS. First, in thanking Dr. Palak Ravel-Nelson for all of your work. We had the opportunity to work together on the nuisance business tours that were organized by my office over the last 4 years since we passed the legislation. And I listened to the line of questioning from my colleague and really completely understand the frustration because we were out on the street and you all were citing businesses for cigarette violations. So I will say that I look forward to working with the new bifurcated licenses and inspections department relative to their increased enforcement around these nuisance businesses. I know I left with frustration at times because you all would do a seize for cigarette sales and then nothing else would happen. And so I look forward to continuing to work with you all in reinstituting some of that work. My colleague, Councilmember Dr. Nina Ahmad, and also Councilmember O'Rourke talked about this week being Black Maternal Health Week here across our country, April 11th through April 17th. And it's an issue that's exceedingly important to me. And I know we heard from the Division of Maternal, Child, and Family Health, but I wanted to talk quickly about what we were able to accomplish in the last budget cycle supporting a Home from Shauna Foundation, which is a Black-founded, led, and run organization that specifically focuses on Black maternal health. They also focus on ensuring that we have more doulas readily available for birthing people here in the city of Philadelphia. So I wanted to specifically focus on how you all are providing support year over year within your budget to organizations like A Home from Shauna Foundation and others that are Black-run and Black-led organizations for the Black maternal health crisis.
Councilmember, if I may add a point of clarification to a response before I get you your answer.
Yes, Council President, if you please do not deduct that from my time.
Sorry, I apologize. I just want to add some clarification to Councilmember Landell's our response regarding the Syringe Services Program. And again, as we've said, it's $654,000. At this point, I think it's too early to say whether or not we'll be able to cover that, but I do feel confident with our partners that it will come together. The other piece, some of those funds will be diverted to sort of bolster or buttress the programs we already have in place to navigate the spikes that we may see as we progress to including treatment and housing.
We're going to do this, right? Because we're on the
Okay.
clock. You're going to
Exactly.
answer Catherine Gilmore Richardson's response, and if you want to do an immediate follow-up with the member, when we recess, y'all can have a conversation because we're still on the same mission to get answers,
Thank you,
regardless
Council
if it's public or directly. Chair recognizes Councilman Catherine Gilmore Richardson.
Thank you, Council President. So my question stands, and then I have a question for DBHIDS.
Okay, I'm going to let Dr. Stacy come back up.
Hello, I am Dr. Stacy Callum, Director of the Division of Maternal, Child, and Family Health at the Philadelphia Department of Public Health. Thank you so much for your question, and thank you for all of your work with A Home for Shauna. That is an amazing program that we are so excited about that you've brought to the city, so thank you for your work on that. I think your question was about how are we supporting community-based organizations in maternal health, and we have two different programs that are grant programs for community organizations. One is through our CAN Community Action Network. That is a collective impact group focused on reducing racial disparities and infant mortality. And for the past several years, we've given out grants to predominantly Black-run organizations in Philadelphia to support their work. Then also through our OVA, which is our Organizing Voices for Action. That's the action team that belongs to a Maternal Mortality Review Committee.
Excellent.
They've also done community investment grants.
I would love to follow up with you to just talk more about that work and how we can work together to support these organizations year over year.
I'd be happy
that'll
to.
be important, okay? And then very quickly for Dr. Bowen, kudos and congratulations on a job well done. I know today is your last day, but we are looking forward to working with Dr. Marquita Williams, and I also want to thank LaVanne White on the team as well. We all have worked together very closely. Thank you all for working with us to institute Tier 1 conflict resolution with the school district in every single school in the city of Philadelphia. I'm going to put this question on the record and just ask for a written response back. It only comes from sort of where we went this morning with OHS, but how does DBH IDS collab with OHS on placement through homeless outreach? Who sets the policy for how those are engaged or placed into a shelter? And then what is the policy for placing folks who are engaged by the outreach team into the shelter? When was the policy established? Is that policy applied to all outreach teams, even those who aren't city funded? And if the policy is different, then why is it different? Does DBH IDS agree with the policy of sending those engaged by the outreach teams through intake instead of providing direct placement? And I'm not asking for a response. I would just like a response in writing to that question. I wanted to get it on the record based on some of the responses we received from OHS this morning. But I'm appreciative of your work and your service. I wish you well in your new career endeavor, and I thank you all for working closely with us to implement Tier 1 conflict resolution for every child in this city. When I started in government, we were only at 50% of the schools, and now we're at 100% because of the work we did together, and that was an everyday climb.
I
So
remember
thank you
sitting in
very,
your
very
office
much.
when you were championing that. It was fabulous then, and it's fabulous now. Thank you.
Thank you.
Thank you, Madam Leader. The chair recognizes Councilmember Mike Driscoll.
Well, thank you, Mr. President. I'm going to submit most of my questions for the record, but I just want to make sure I'm hearing this correctly, because as you know, the Kensington Caucus is working very hard on a massive undertaking. And am I hearing that between DBH and housing and health that we do have the capacity to participate in the resettlement actions scheduled for the residents of the encampments down there?
So,
Or is that just with your affiliates? And if it is with your affiliates, do we have the capacity?
I think the triage and wellness, development of the triage and wellness piece of it is an important part of it. And that's happening not just like DBH IDS, it's a multi-agency effort that the city is, leading to develop some more of the kind of capacity you're talking about. I was responding initially from what do we have, because we know we have empty beds, we know we have overflow capacity. To Councilman Harity's point, well, does that match the 695, whatever that is? The triage and wellness is really an undertaking also as well.
That's good to hear. And then lastly, this is more with regard to the $100 million allocation for the mental health funding for youth. The question I have is, will the county or the district staff the services? And will non-treatment services such as intervention be provided? And how will these services be sustained after the initial allocation is expended?
So that's not coming through to us.
It's not?
Not through to DBH.
It's going straight to
the schools.
School
So we do partner really, really intensively with the schools. So there may be, and they turn to us when they need our support. They have, so that's not clear to me at this point
Okay.
exactly how it will be.
Wasn't clear to me either.
What?
It wasn't clear to me where it was actually going.
Yeah.
Okay. All right, thank you.
Yep.
Thank you, Councilmember Driscoll. The chair recognizes Councilmember Young.
Thank you, Mr. President. This question is for public health. Can you tell us the last time the city has done an assessment of our healthcare facilities, I guess to determine the viability in those communities, particularly with the large number of urgent cares that have been popping up all throughout the city? Could you tell us, has there been any assessments done to look at what our health centers are providing, the need for them, et cetera?
Thank you, Council Member. I'll have Sarah Anus, my Chief of Staff, come up.
Good afternoon. My name is Sarah Enos, Chief of Staff for the Department of Public Health. So at the 8 community health centers, we are constantly evaluating program. And so the bulk of our program, about I think 80% of our practice is adult medicine. And so we look at the needs of that population. One of the, I think, unique aspects of the health center, and I think Councilmember Harity, you asked this question earlier as well, is our ability to refer patients to specialty care. And so each health center has a contract with a local, one of our, many local healthcare, institutions, hospitals, where we can refer someone to see a cardiologist or a rheumatologist to meet their healthcare needs. And we do that, at no cost to the patient. And so we're able to, evaluate what our patients need, what their diagnoses are, and then refer them out. So it's a constantly evolving process in terms of patient demand and what patients need. And so while adult medicine is the majority, our supportive service and our menu of supportive services continues to grow. And so in addition, to adult medicine, we have pediatric care, dental care. We're looking to expand the services that we provide in that dental clinic because we recognize dental care as a barrier for a lot of our patients and a lot of Philadelphians. We have a very comprehensive women's health program. We partner with local hospitals for prenatal care with their midwife programs, and then our patients deliver in hospital. Pharmacy, lab, all of the sites, sources on one site, in addition to our patient navigators, our social workers, our benefits counselors, our outreach and enrollment specialists. And so as our need as our program grows, so do our supportive services. And so we really, I think it all depends on what we're seeing when folks come in the door, and then how we're able to respond with the staff that we have, when we're fortunate enough to receive some grant funding as well to expand that program.
Thank you. One more question about the Philly Joy Bank program. I know that it's based off data that was collected from Canada, but I just want to, for the record, let folks know that Canada has a universal healthcare system that we do not have in this country. And Canada also, those towns in Canada that do not also have the same type of social issues that we have here in Philadelphia as well. And so I'm just cautious about providing that level of, that stipend monthly to individuals who to do what they wish freely, right? And there's no particular goals. And so can you tell us what other services will be provided on top of just this $1,000 that's being provided a month?
I'm Dr. Stacey Callum, the Director of the Division of Maternal, Child, and Family Health at the Philadelphia Department of Public Health. Thank you for the question. So yes, in addition to the cash as part of the Philly Joy Bank, it's a comprehensive program where we'll be offering voluntary services to program participants, which are all services that my division already offers, but will be helping folks who are in the Philly Joy Bank enroll. So it's things like doulas, home visitors, lactation support.
But these are voluntary, right? So they're not
Correct.
necessarily have to go through these programs. Okay.
Correct.
Thank you, Mr. President.
You're welcome. Any members for a third round, I'm going to ask for you to please submit your questions unless you have a burning desire to call these two departments back, because before we wrap up the day, we still have other departments that we have to cover today. And so unless you say you definitely want to bring them back, let me know. But the third round we will not be doing. Everybody had a full 2 rounds, and we've been here for a couple hours on this one department. And so with that being said, Dr. Jill Bowen, thank you for your presentation, your testimony, as well as Dr. Franklin. I also want to acknowledge Mr. LeVan White from the Department of DBHIDS. Anytime that there's a killing or a murder in the streets of Philadelphia and I'm looking to do the trauma outreach and trauma support, I will call LeVan first, and he will make sure that I'll have a team out there working with me to address that issue. Thank you very much. With that being said, next up we have the Department of Planning.
pleasure. All right, take care. Be well.
I know you're leaving. Take care. We'll see you tomorrow. Yeah, tomorrow. Yeah.
To all the members, just had a question. As we start this next line of questioning for the Department of Planning, are the individuals I see on the screen, are y'all queued up for this particular session, or are these a holdover from the last session? Okay. Just wanted to be clear. This session. Okay. Now, I want to also commend my colleagues for the deep dive on issues that are critically important, and I believe that all the departments that we ask questions are critically important, but a lot of the departments that have immediate impact on the lives of a lot of our constituents take a little longer than most, but they all are relevant to us addressing the issues and concerns of the citizens here in the city of Philadelphia. So I just want to commend everybody for doing their due diligence. But this won't be any different. And so with that being said, Helen, can you please call the next person for testimony?
Yes, John Monlack, Interim Director of the Department of Planning and Development.
Thank you, John. It's just yourself today? They gonna leave you out there like that?
We'll see how that goes.
No, it's all good. Just state your name and title for the record, and please begin your testimony.
John Mondlack, Interim Director of Planning and Development. Good afternoon, Council President Johnson and members of City Council. I am John Mondlack, Interim Director of Planning and Development, and joining me today are senior members of my staff, as well as the executive team of the Philadelphia Housing Development Corporation, PHDC. I'm pleased to provide testimony on the Department of Planning and Development's fiscal budget for 2025, our operating budget, and I'm proud of Planning and Development's efforts over the past year. In collaboration with the Philadelphia Housing Development Corporation, we worked to clean, green, stabilize vacant lots through a partnership with Philadelphia Horticultural Society, made significant investments in neighborhood infrastructure via neighborhood preservation initiative bonds, created approximately 250 units of affordable housing, supported home repairs with over 6,000 households, assisted 1,100 first-time home buyers, helped secure dedicated staffing to bolster the eviction prevention efforts, launched a rental improvement fund to support small landlords, collected $7.3 million in revenue via the mixed income housing bonus program, and reimagined a new community engagement strategy for the comprehensive planning process that uses equity as a lens. In the next fiscal year, DPD, Department of Planning and Development, will create a one front door to access city home repair programs and services, reducing administrative burdens on people in the city that need these services. We're going to institutionalize the Philadelphia Home Appraisal Bias Task Force by adding staff to build up our capacity and implement their recommendations. We're going to continue to scale right to council to add additional zip codes with the goal of leveling the playing field at landlord-tenant court. We're going to continue our efforts to provide opportunities for first-time home buyers through land bank RFPs, first-time Philly First Home, Home Buy Now, and Turn the Key mortgage programs. We'll hopefully resume the acquisition of tax-delinquent vacant properties through the sheriff's office, which looks very promising at this point. We're going to provide needed structural and financial support for CDCs and nonprofit developers to allow for development of a full range of affordable housing options on land bank-owned property. We're going to launch an equitable and inclusive comprehensive planning process that emphasizes outreach and engagement with hard-to-reach neighborhoods and individuals. Residents confront challenges in securing and maintaining high-quality affordable housing and experience quality-of-life challenges. Small businesses and developers struggle to navigate the complex regulatory requirements of doing business in Philadelphia. Understanding the magnitude of these barriers, Planning and Development and its partner, PHDC, stand committed to addressing them. I will now briefly highlight some of the recent accomplishments and some of the activities in the coming fiscal year we plan to undertake. We will continue to create and maintain thriving communities through investment in affordable housing. By leveraging housing trust funds, federal resources, including community development block grant money, and neighborhood preservation initiative bond funding, Planning and Development and its partner PHDC have produced new affordable housing and special needs housing units, preserved existing affordable housing through repair programs, offered eviction and mortgage foreclosure diversion programs to keep people in their homes, and created new home ownership opportunities. Planning and Development and PHDC have accepted Mayor Parker's bold challenge to facilitate the production and preservation of 30,000 residential housing units in Philadelphia during her term. In fiscal year 2025, Planning and Development and PHDC will continue its successful housing production programs like Turn the Key, as well as continuing to invest in home preservation programs like Basic System Repair Program, Adaptive Modification Program, and Restore, Repair, Renew. We will support our neighborhoods through blight removal. Planning and Development partners with PHS on several successful programs, including land care and workforce development. The programs Clean, Green, and Stabilized Lots. In fiscal year 2023, the program maintained more than 13,500 lots. In fiscal year 2025, Planning and Development will continue to partner with PHS on this important work using CDBG funding to support that effort. Development resources. In collaboration with other agencies, Development Services updated and expanded the development checklist, which will be released in the coming weeks. The checklist provides a comprehensive overview of the requirements of real estate development in the city, provides useful tips, contact information, and links to useful resources. In fiscal 2025, Development Services will continue its work with other departments and agencies to make the development review process more accessible, efficient, and predictable. We will engage all residents in creating a vision for Philadelphia. In collaboration with a diverse steering committee of Philadelphia residents and experts in DEI and community outreach, Planning and Development developed an equitable and inclusive process for engaging various public participation in a needed update to the Philadelphia's land use comprehensive plan. Planning and Development will dive deeper into the engagement process, partnering with trusted community organizations, resident working groups, and resident ambassadors to reach individuals and groups that have historically been excluded from the planning process. This is just a sample of our work, and it concludes my testimony. Thank you for your time. Thank you for your leadership and your partnership as we work to increase accessible housing options for both renters and homeowners, ensure vibrant and equitable communities, and help build intergenerational wealth. And if there's no questions, I hope everybody has an enjoyable
Thank you. I wish it was that easy. Thank you. Just have a couple of brief questions, and I'll then relax my time to my colleagues. Just a couple of things. Now, I know you talked about support for programs like basic systems repair, certain amount of units under turnkey. Just for the record, though, those initiatives are already taking place, the majority of them, prior to this administration. So y'all starting new from January 6th is when we took the oath of office in terms of moving forward. And so I just want to acknowledge that those key things that you talked about in terms of the number of affordable units created, the work that was done regarding basic systems repair, rental assistance, that started under City Council, under the leadership of former Council President Darrell Clark. And so with the new administration, we will talk about what we'll do working in partnership or collaboration as we move forward. So when you talk about rental assistance, this current budget has an $18 million reduction, which eliminates rental assistance in the same-day work program. And we actually work very hard to create the same-day work program as a way to alleviate poverty and also to combat gun violence with young men working to clean and green lots throughout the city of Philadelphia. So can you give us an idea why there would be an $18 million reduction?
I'll address it in two components. The same-day work and pay program is a smaller piece of that 18 million, and we acknowledge and agree that it's been a very successful program, and we will look for other funding. We'll utilize probably CDBG, but we also have access to Housing Trust Fund and NPI bond proceeds. So we plan to find the money to keep that program at the same level that it's been operating at.
Okay, and speaking of, so you're going to look for other outside sources for same-day pay program?
And that constitutes a smaller chunk of the 18. The other 15 million is the bigger chunk that really helped with rental assist in the diversion program. We are at a pace right now. So every year for the last 2 years, we've had $15 million general fund and $15 million housing trust fund. So we've had $30 million in the program. For the past 2 years, within the extra $15 million that were committed to from housing trust fund money, that's $75 million. When that program started, it took about 8 or 9 months to ramp up that program, to initiate it, to create it, to get it running. And so that delay in getting it started in 2023 actually meant that we were a little bit behind in the spending. And so there is still money, and we don't think that we're going to have to cut any of the funding that's currently in there. We're just going to have to spend through the money that we still have, plus the extra $15 million from Housing Trust Fund. And that should take us to the end of fiscal year 2025. And if it doesn't, if it falls a little bit short, we would find additional resources and other sources to fill that gap.
So let's go on the record. How much is currently in the budget for rental assistance? How much is the administration proposing to add to our budget for rental assistance?
For rental assistance, it would be
matter of fact, let me clarify, because I hear you saying we already have money. Basically, that's the reason why we're not proposing any new funding. Is that correct?
Yes.
How much is that? Just want to be clear.
We're going to add another $15 million, and that will allow us to spend exactly what we're spending now through the end of fiscal year, which we think it takes us, if not to the end of fiscal 2025, very close to the end, and if it's short, then we'll fill in the gap, but it shouldn't be a significant amount. So if you really want a more like dollar numbers, I can call somebody up that maybe could answer that more precisely.
If you can provide that to the chair members of our committee.
Yeah, absolutely.
There's a $3.5 million reduction from the land bank budget. What is that associated with? I'm assuming it's related to liens on properties throughout the city, but I want you to give us an overview. Why is there a $3.5 million reduction in the land bank's budget?
The reduction is because the money that was put in last year was never spent on acquisition because there were no sheriff sales. And so it hasn't been put back in, but we still have that money that we hopefully will be spending, assuming the sheriff reconstitutes sheriff sales on vacant delinquent property.
You talk about basic systems repair. That particular program, how much is budgeted in this particular budget from the administration to help repair individuals' homes?
For that, I am going to call somebody up just to make sure I don't get the number incorrect. Either Paul or Mark.
Matter of fact, let me back up for a second because I do see Andrew Rodriguez. Can you please come to the table, sir? Just trying to get an idea. I know you do a lot of hard work to try to get those properties out of the land bank. That's been your mission since you've gotten here. Giving us an idea regarding the $3.5 million reduction to the land bank's budget. And, you know, according to Mike, the reason why is that the money hasn't been used for acquisition. So tell me what we need to do to for the acquisition of additional properties that can go toward affordable and workforce housing. And also, if we aren't achieving that, what is the obstacles that we must overcome to accomplish it?
Good afternoon, Council President.
Good afternoon. You need to speak on the mic just a little louder, my friend.
Angel Rodriguez, Executive Director of the Land Bank. Good afternoon, Council members. So just as a point of clarification, the Land Bank is experiencing what you're seeing as level funding. So in previous years, in fiscal year 23, we were funded at $6.5 million. $3 million is for operations, $3.5 for acquisitions. In June of 23, the end of the fiscal year, the land bank did draw down that 3.5. We have access to that, and it is in escrow right now. So what we have in fiscal year 24 is another level funding of 6.5, so you have another 3.5 in reserve. So for this year, the land bank is funded technically at 6.5. So we do have access to 3.5 million plus the 3 million for operations.
What's the obstacles for the acquisition of land so we can put that money to use?
Well, once sheriff sales resume, as the mayor and the sheriff have talked about over the summer, we do have a bill in committee right now that would allow the land bank to continue to use its priority bid sale. I'm unaware if the council is aware, the Supreme Court had issued a ruling in Michigan or Minnesota, I believe, Hennepin versus Tyler, which called into question the land bank's ability to exercise its priority bid. City law crafted in conjunction with land bank's law offices a bill for the consideration from council, which would add levels of notification addressing the concerns put forth by the Supreme Court, and then allow us to continue to utilize our priority bid. So once that bill is passed, we'll be able to exercise that priority bid. Currently, we're working with Revenue to identify those properties because sheriff sales stopped at the beginning of the pandemic, in which case a lot of the judicial decrees had ended. I know they've been doing a great job of reissuing them, so we're just right now looking at what the schedule will be and also the timing of when those identified properties will be coming to sheriff sale. It should be noted that not everything comes up to sheriff sale at one time.
Okay. All right, thank you very much. Michael, let's go back to Basic Systems Home Repair Program. We're talking about the repairing of individual homes. How much is allocated in this proposed budget for FY25 to Basic Systems Repair from the administration standpoint, and not MPI, because MPI is a whole different conversation.
I don't think any general fund money is spent on basic system repair, but so the answer, general fund is zero, but are you still looking for the amount that will be spent from other sources?
Well, I want to get an idea of why we aren't on the general fund side separate from MPI. Is there a reasoning why we aren't investing in basic systems repair on the general fund side? I'm sure there's a strategy behind it, or reasoning why we're not investing in helping people repair their homes.
Mark Dodds from our Division of Housing and Development will join us.
Mark Dodds, Interim
doing,
Deputy
Mark?
Director, Division of Housing and Community Development. Right now in FY24, there's currently $40 million allocated to the Basic Systems Repair Program.
From the general fund?
None from the general fund.
That's one to be clear, because again, MPI is a council initiative totally separate from the administration, right? I mean, we may collaborate as the time goes down the line, but just want to be clear, we're talking two totally separate pots of money. And so, but for the record, right now, under terms of this proposed FY25 budget, there is no proposal for funding for basic systems repair, correct?
Not in the general fund.
Okay, just wanted to be clear on that, because members have been asking, so we can get a little bit of clarity on how we move on this process. I'm going to relax my time to my members. Just another question in terms of the organizational chart for the planning department. So give me an overall of what that chart looks like. I know you have an interim director. I know we have a goal of 30,000 units in 4 years, and obviously we want to be supportive of that process, but the devil is always in the details. And so is that 30,000 of affordable workforce units? And then also, what's the organizational structure?
I think to answer the first question, the 30,000 is going to service all levels of incomes. It's not going to be any particular level of affordable or just affordable.
So you mean it could be a combination of affordable, workforce, market rate, correct?
Yes, correct.
All right. I'm only asking you that because members are asking me.
Of course.
When we are in meetings just for clarity, and so it's best to get clarity from the Planning Commission. And also, what's your organizational structure?
So I could certainly follow up with an organizational chart, but we have a Division of Housing and Community Development. Mark Dodds is the interim director of that group. We have a Division of Planning and Zoning, which Martine DeCamp is the interim director of that group. We have a Division of the Administration, which includes finance, IT, and personnel, and that is Darshana Patel. And we have a Planning and Zoning Division, which is Kathleen Grady.
Would your team be the same team that would be reviewing the Sixers Stadium, Comcast, Spectacor, and other major projects that come through the city of Philadelphia?
We are one of many departments that review those projects.
Okay, thank you. The chair recognizes Councilman Phillips.
Thank you, Council President Johnson. I want to know, what is the average cost associated with driveway repairs? Please provide the council with a work plan and a cost estimate to address the driveway intake for applications submitted last year. Right now in the 9th District, among other council districts, there are a number of outstanding responses to driveways, and we need to come up with a systematic response to that. So we want to see what is it needed to get to the end goal, which is fixing these driveways.
Would you like us to submit the number?
That would be nice. If you, and also, do you know the average cost, or you would like to submit that as well?
Average cost as well, okay.
Okay, great. How many contractors have been hired to complete driveway repairs? Is this enough?
Okay, I could probably ask Angel to come back up to maybe
Okay,
answer.
Angels.
Or David, sorry.
Good afternoon, Councilman. David Thomas, President, CEO for PHDC. I think your question was how many contractors have been hired for repairs to driveways to date? Yes. We have 2 contractors as of today. We're working with the Streets Department to try to multiply those numbers by working with their contractors.
So clearly we're working with the Streets Department because the 2 contractors are not enough.
The 2 contractors are not with the Streets Department, so we're trying to get their contractors involved.
Right, so we're hiring the Streets Department because we're in need of more contractors to complete the work because of the high volume, correct?
Because of?
The high volume, is that why we're going towards the streets department? Because 2 contractors doesn't seem like enough for over 160 driveways that have been potentially approved.
I don't want to say that it's not enough yet. I will say that it's been a slow start given the weather that we've had. I don't believe that 2 will be enough to get to 180, to the question that you just asked. And what we're trying to do is figure out the best way to scale it out. So as you recall, we started as a pilot. We figured out some challenges that we've had, and we've now resolved those issues. We believe we have a path forward to multiply the number of driveways getting done over the next couple of months.
Got you. Are there plans to expand neighborhood infrastructure repairs outside of the basic systems repair program and adaptive modifications program for the duration of the neighborhood preservation initiative and beyond? And will street trees be added to the list of options to be also be considered?
Yeah, some of that is above my, I won't
okay.
say my pay grade, but I wasn't in a lot of these conversations, but I can tell you that I'm speaking to a lot of folks about retaining walls, as you're familiar with.
That was one of the questions, because I wanted to know when we're going to begin repairing some of the retaining walls, and could you describe the work plan for retaining wall repairs for this fiscal season and next?
Now, I can probably give you a schedule. I can't give you too much detail at the moment, other than the fact that it has been a little slower than we like because of the engineering process.
Exactly. No, this is great. Well, listen, there's incredible excitement around the MPI program, particularly with our driveways, and neighbors are understanding of the fact that they may or may not be selected, but if we're pushing this for our neighbors, we want to be able to have a very transparent, efficient, and effective process where people can be able to see, touch, and feel what is transpiring with the hard work that they put into the petition process as well. They really want this. This is why City Council has approved this money. So we want to find a way to how we are going to get to the end goal, because there's about 150 to 160 driveways that are left. And right now, we've only done a couple, right?
12, I think.
12 driveways, right. So I want us to figure out what is the plan where we could say by 2026, with this type of funding, we will be able to have this done. Or by 2025, we'll be able to have this done, ideally by the end of 2025, right? That would be nice. But it's at least giving our neighbors a concrete understanding instead of having to wait when that funding, if they're going to get their driveway repaired or not. So that's all. I think we get calls all the time about that. So I want all of us in the city of Philadelphia who are working to feel that pressure as well.
Yep.
All right.
Understood.
All right. I think Council President, thank you for your time.
Thank you. The chair recognizes, she's not here. The chair recognizes Councilmember Nina Ahmad.
Thank you, Council President. I just want to clarify, thank you for being here. I want to clarify the issue around the carry forward in the Housing Trust Fund. So in FY24, the city budgeted about 102.9, but estimated to having actually spent about half of that. And what you said was because of the lack of sheriff's sale, there weren't enough properties to acquire. So I don't know if that is actually the reason. So the question is, why is the money not being spent? And why is there a significant increase in FY24 again?
So the money for acquisitions wasn't spent because there were no sheriff sales?
Sales, okay.
And so we still have access to that money to spend it hopefully in the next fiscal year. But I don't think that answers all of your question.
Correct.
What's the rest?
So the rest was, we see an increase, even though you haven't spent it down, you're asking for a little bit more money. So again, so is that because you're anticipating being able to have a faster clip of acquiring properties?
I'm going to ask if anybody can come up and correct me, but I think we're asking for the money just to maintain the lots. I don't think we're asking for any more acquisition money than we already had but didn't spend.
So you have like a $10 million difference between 24 estimated and 25. So you're getting a little bit more, asking for a little bit more money, and I was just wondering, since you haven't spent down everything from before, what is the reason for that? We have to count every penny.
Yeah. Yeah, I don't either. So I'm afraid that I don't think I understand.
So the question is that you have not spent the money down, what you had, and you're estimating your obligations to be half of what you have left over. So you have a lot of money left over, is my point. And I'm saying the new budget that you're proposing, does that have any increase than what you had in 2024, which you hadn't spent down anyways? Is there more money you're asking in FY25?
I don't believe we are asking
So
for more money.
you're at the, and the answer to that is because of the land bank issue of not having properties to buy.
To acquire through the sheriff's sale process.
Okay, so anecdotally, I have gotten information from folks who work and engage with the land bank that there's a lot of delay in the properties that are actually available in terms of getting them processed. Can you address that? This is anecdotal, so from multiple sources, that people who are in the process of acquiring these properties encounter a lot of delays in getting these properly processed.
This is specifically with respect to land bank disposition.
Correct.
Councilwoman Angel Rodriguez, Executive Director of the Land Bank. Councilperson, could you define, are you talking about dispositions for development?
Yes.
Open space? Okay. Typically, when we award dispositions for development, but we do not go to settlement until the developer has their entitlements. Now, typically, and I think everybody here is aware of the length of time, typically it'll take 6 months if a variance is required, or if they're subdividing a property that will also require something, a certain amount of time. Also the type of development. If a developer is looking for slab-on-grade development, that's usually could happen rather quickly. But if you're doing a full basement, then you're looking at sheeting and shoring and certain other levels of requirements that are there. So typically, we won't go to settlement until they have all of their entitlements. The reason for that is just past history where typically the city would transfer properties without, development agreements and things like that. So this is a way to ensure that they're ready to build and they can actually build and produce the units in the given amount of time, which is typically 18 months.
All right, thank you. I just wanted to put that on the record since I have been asked. I'm wondering also about the community gardens that you have, funds that you give towards community gardens. Are these kinds of purchases that are made budgeted for? Are they funded through some mid-year transfer? And if the community has input as to about these parcels?
I was wondering, Councilperson, could you clarify that? Are you
Yes.
saying acquiring land at sheriff's sale?
So when you purchase these properties that you're going to give to for community gardens, are these budgeted for, or are these sort of you just come up on them and you have a mid-year transfer, and is the community engaged in the process of which parcels you're acquiring to give to them?
So to answer the last question first, our acquisition list is, if you look at our acquisition policy, is made up of requests, and anybody can request a property to be acquired as per the acquisition policy. We then vet that, and then we vet it with the council office, the council district office, for acquisition. The typical spend that we have, so $3.5 million is usually typically what we budget for the acquisition of 325 properties. But that has no impact on disposition. As per the disposition policy, we convey to nonprofit groups for gardens and open space nominally. So it's a dollar sale. There's typically a mortgage or note tied to that, but it doesn't really cost. They're kind of two separate issues. So acquisition for municipal tax sales, we average anywhere from $8,000 to $12,000 for a parcel. but disposition really is almost, it's nominal.
So I think really the question is there a strategic overview of where these parcels are, and do you build that into your budget that we're going to acquire so many of these community gardens?
Correct. Usually we get requests from groups like Neighborhood Gardens Trust or council offices or long-standing community groups that have been occupying and utilizing the open space.
And how does this feature into our mayor's greening piece of her proposal? Is that a part of that, or is that something separate?
I believe it's a subset, clearly. But for typically what we acquire to go out, I think this is a tiered approach. So you have the land bank acquisition for community groups. Obviously, you have the urban ag plan, you have the tree plan. So there are a lot of other issues, and sustainability office has their initiatives as well.
And my final question about community gardens is, whose responsibility is it? Sometimes you have a very engaged group of people who do the upkeep. Is there a transition plan, or how is that space maintained over time?
So while properties are in the land bank's inventory or one of the land holding agencies, with the exception of Department of Public Property, we are responsible for the upkeep and maintenance of the properties while it's titled to one of the agencies. Once it is sold, it is the requirement of the new property owner to maintain the property.
All right, thank you.
No, thank you. And I think also what Member Ahmad is also referring to as well, when we focus on, cleaning and greening, City of Philadelphia and the administration's plan, that there's a strategic vision with the land bank around that whole concept of cleaning and greening, but most importantly, gardens, right? The green space. Is that incorporated into what the administration is trying to accomplish in terms of cleaning and greening the city? Strategically, is that correct, Member Ahmad? That's where she was getting it. Not a subset, but a strategic plan that I'm sure everybody's around the table is saying, as a part of our plan to clean and green, here's how we're going to look at maintaining green space as a part of that plan. Is that a part of the plan?
Well, yes, it's part of the mission of the land bank.
Always been a part of the mission.
Always been a part of the mission of the land bank to balance uses between green space, development, business expansion, and the like.
You've done that with me in the past before, so just stating that for the record. The chair recognizes Councilmember Jay Young.
Thank you, Mr. President. I want to talk about NACs and CDCs. So can you tell us in the fiscal year 25 budget if there are any new core operating support for CDCs or any housing counseling agencies or any NACs? Particularly, I know I got a call from some of our folks who work with the NACs and stated that, they told me they didn't have any fringe benefits, right? There's no health care for the folks that are servicing the most vulnerable populations and providing the city service, essentially. So could you talk to us about any investments in our CDCs, in our housing counseling agencies, and in our NACs?
Sure. Mark Dodds is going to join me for that.
Good afternoon. Good afternoon, Council Member. Mark Dodds, Interim Deputy Director, DHCD. Just to start off with the NACs, so we share that same concern. We recently passed amendments to our contracts with the NACs to support benefits for those individuals working in the NACs. So that was something we also recognized. As far as additional funding or funding for FY25 for NACs and housing counseling agencies, the majority, if not all of that funding comes from sources outside of the general fund, and we are still working through that budget process.
So those are federal grants you're speaking of particularly?
And local housing trust funds as well, yes.
Okay. The city is going through, we had the 2035 plan, right? The comprehensive plan. Does the city plan on addressing some of the issues related to the comprehensive plan? What progress has the city made in updating the comprehensive plan? And are there any staff increases or staffing impediments to updating the comprehensive plan?
That's a great question. I'm going to ask Martine DeCamp if she can come up and tell you all about our plan.
Hello. Martine DeCamp. I'm the interim director of the Planning Commission. Hello. How are you? So the comprehensive plan is something that we're excited about. The Phila 2035 plan, I think it was the first comprehensive plan that we had done in 40 years. So we accomplished a lot during that time. We're continuing to implement recommendations out of that plan. So, I mean, that's partly one of the reasons that we were able to devote so many resources to Broad, Germantown, and Erie, the WSIC and Transfer Center, a number of other projects that helped us get everyone on the same page and working towards some common goals. So we did take a step back after we did that because we wanted to make sure, there were some questions about, did we reach enough people during that process? Did we include enough voices in that process? So what we've been doing for the last couple of years is that we developed a steering committee that was made up of some of the folks from the different mayoral commissions. We also put out an application to general citizens. So we received, I think, 800 applications. So we created a steering committee made up of those residents that would help guide us figure out what's the best way to reach more people from the disabled community, more people from Black and brown communities, more people from different religious backgrounds and socioeconomic backgrounds. So we've been putting together a plan. The most recent thing that we've done is that we've paid our steering committee, and we have also created a working group now of individuals, mostly from our Citizens Planning Institute that we've been running for over a decade. And these folks are helping us develop the tools that we'll need to actually do the outreach. We did recently hire additional planners, I think in FY23 and FY24, so we have no additional planners now, but we are looking for funding to continue the work that we're doing, both with the working group. We'll be needing to find money to actually do the outreach, because as everybody knows, it's a costly effort to actually be reaching as many people as we want. We'll be looking at translation services, and we are looking to make sure that we're addressing some of the social needs and social issues that came up during the last comprehensive plan process. I think previously we mostly focused on capital improvements and physical improvements, but we want to make sure that we're figuring out how we address some of the others as well.
Thank you. I heard the bell, Mr. President. So.
Thank you. The chair recognizes Councilman Rulandau.
Thank you. Thank you. Thanks for being here. I just want to make sure I was clear on something I heard, that in order to fund TFA, the Tenant Financial Assistance, you said that you believe we have enough money under the current program. We have enough resources currently to fund it through FY25.
Yes, and if I can, because there might be a shortfall that we think we can plug, but Mark, if Mark could come back up, and because I don't know that it takes us exactly to the end of the year, and Mark could give us a better idea.
Hi, good afternoon. Mark Dodds, Interim Deputy Director, DHCD. Yeah, so if we invest, and we plan to through our annual action plan process in conjunction with you all, if we do invest an extra $15 million in Housing Trust Fund for FY25, that will get us to, that will allow us, through our projections, to sustain the programs with its current level.
Okay, and do you think that will satisfy it will cover the 100% of the needs of the landlords and tenants. Now, knowing there's increased costs for tenants and landlords in the city, will that cover 100% of the costs?
I would say that you're right, the need is great, and it would allow us to continue the program at its current level.
And then, just to follow up on this, I believe this is not fully your purview, but I know there's going to be an expansion, a proposed expansion of PEP and right to counsel, right?
Yeah, we add a couple zip codes. We're adding, I think, 4 zip codes in the next fiscal.
And that has funding associated with it as well?
It does.
So that's going to increase the amount of landlord-tenant relationships that could use tenant assistance funding. These are folks, normally if there's a tenant, didn't have a lawyer, got a judgment entered against them, move on, try to find another place to live. This is going to be actually, someone who's represented in court and could use this tenant assistance, this rental assistance, in order to offset the rent that they owe. So just want to keep in mind that, we on council, I think there's many of us who are very interested in making sure the TAF, the rental assistance, is funded at the level that it needs to be funded in order to keep tenants in their households.
Understood.
I had a couple, well, Mark, while you're here, I know that the most recent fair housing policy is in draft form still, I believe, from 2022. And this is the like affirmatively furthering fair housing draft.
Correct.
Is that being updated soon?
Yeah, we'd like to close out that process, and and that I can explain is due in large part to the feedback we got. We did convene a number of stakeholder groups to comment on our draft version of the plan. We got a lot of feedback. It needs to make its way into the document, and we'll make that final.
Okay, thank you. It's just always helpful. It's a nice roadmap for where we are in the city and where we need to go.
Agree. That was actually a voluntary effort that we took place. There was, yeah.
Doesn't HUD mandate that we do it every certain years? I know our last big one was 2016.
There's a proposed rule now that will alter the way in which they require that information.
Interesting. Okay, thank you. And, oh, I love the proposed one front door system. My gosh, as the head of the Information and Technology Committee, it's music to my ears that you have one place to go to have residents apply to multiple home repair programs simultaneously. We are all as fried as you are. Thank you for staying through the day.
Thank you.
Do you have enough funding? What's the timeline for that? Do you have enough funding for that? How do we get that replicated throughout the city and all the other departments? That might not be your answer.
I don't know if I could answer the last part fully, but we have enough funding for it. We expect it to go live in June.
Oh, that's excellent.
So
That's excellent.
it's being coded right now, so it's actively under construction.
Wonderful. Thank you so much.
Thank you.
Thank you. The chair recognizes Councilmember O'Rourke.
Thank you, Council President. With the support and leadership of Council President Johnson, actually, before I even got here, the city has contributed $60 million in rental assistance over the past 2 years, which combined with the eviction diversion program has made it possible for thousands of landlords and renters to avoid going to court over an eviction filing. The program is a national model, praised by the White House, by the governor, for stabilizing neighborhoods and keeping people in their homes. Now, I know you just mentioned that the program funding is being cut because the program still has money sitting there. But why are we not trying to expand the rental assistance funding that's available? Eviction diversion and rental assistance are vital resources for Philadelphia renters, and it seems to us that we should be doing everything that we can to expand these programs. So you can just speak to that on the record, why we wouldn't be expanding this program?
I can say that we are continuing them at their current level, which I think is excellent, and and very beneficial to City of Philadelphia residents to expand the program. We can certainly try to, it would require staffing, it would require additional time, similar to when we launched the program. It took a little bit of time to get going. I think we would probably want to take a deeper dive and see what the need is, to see how much additional resources, what the payback would be before we did that. But I'm not objecting to...
The payback is making sure people aren't homeless.
Right, just to make sure that it's put to good use, that it's available to serve the public.
I just want to clarify that the $15 million from the Housing Trust Fund will still contribute to the targeted financial assistance program for FY25, correct?
Correct.
And in your budget, you also include a $10 million grant from the Housing Trust Fund for housing development. Where is this money coming from specifically, and what is it going to specifically? What's it being used for? If you can detail that for the record.
That's a complicated question. I don't know if you, I mean, we have about a dozen funding sources, and we could maybe talk through some of them.
Could you?
Was there a specific line item you're referring to in the Housing Trust Fund budget?
It's literally housing development is how it's itemized. Housing development.
So the question is, what money, what funds of money are spent on housing development?
I'm asking where is the money coming from, and how are you using it? What's it going to be used for, if you can specifically speak to that?
So the money from the Housing Trust Fund comes from two different sources. There's a recording fee and a general fund sub-fund. 0.05% of the city's general fund goes into the Housing Trust Fund, as well as recording fees from various mortgages, deeds, instruments like that. I can't speak specifically. Maybe I could address your question outside of the hearing, but I'm not sure specifically what line item you're referring to at the 10 million.
For the sake of time, we'll do that. Let me move on to the land bank. Over the past 2 years, Minority Leader Brooks worked extensively on protecting community gardens and public spaces with the U.S. bank liens on them. Want to acknowledge Dr. and Councilmember Ahmed's interest in this as well. As a result, the administration made a commitment that the land bank would acquire 80+ U.S. bank lien encumbered properties for which this body appropriated funds in FY23. However, I don't see any dedicated funding in the land bank's acquisition budget for the gardens. Can you guarantee that this funding is budgeted for the land bank to acquire these community gardens and public spaces?
I can't say that we have guaranteed that specifically for the gardens, because it would be a timing issue.
Okay.
So as you're aware, yes, the Revenue Department did purchase back the liens from the U.S. Bank, which secured the lien back with the city. I think it depends on if the city has the decrees in place, and when sheriff sales start, would we be in a position? And also, we would need the bill to pass for us to do that. So if it came up in a timely fashion in the next fiscal year, in fiscal year 25, I don't see why we wouldn't acquire them.
Thank you, sir. Can you give us a specific number that is dedicated to the land bank acquisition in FY25?
Currently, we have escrowed $3.5 million. So we have $3.5 million in the bank right now.
And what portion of this number is dedicated for community gardens and urban agriculture?
That is simply for acquisition, because of the way acquisitions work and decrees work.
Okay. Thank you, Council President.
Thank you. Councilmember Lozada.
Thank you, Council President. Very quickly, because I know that we are limited in time. Can you tell me when was the last time that a housing counseling contract was issued? Can you share with me the list of housing counselors in the 7th Council District? And can you tell me how is oversight provided for each one of those housing counseling providers?
Yeah, we could definitely provide the list to you. I don't know if we could provide it now, but we can certainly follow up with that list, and Mark can hopefully answer the oversight question.
Hello, good afternoon. Mark Dodds, Interim Deputy Director, DHCD. I'm sorry, I didn't catch everything. Sorry to make you repeat. Could you?
So I asked for the list of
7th
housing
district.
counselors in the 7th. When was the last time a housing counseling contract was issued? What is the oversight provided to housing counseling providers?
Yes. So the last time a contract was issued, and sometimes it's confusing, contracts are amended annually. October 1st, 2024 was the last time it was either issued or the contract was amended. I think we're considering doing an RFP process, not for FY25, but for FY26, for any new agencies or to evaluate the way existing ones are performing. And the way it's currently arranged, the structure within the organization is housing counseling agencies are divided up among the contract analysts, and there are a number of analysts that oversee a number of different agencies. They have direct touch points with those agencies, and there's also what we call in-service days, where there'll be a citywide meeting with the different agencies to go over issues that cross council districts and organizations.
Can you share with me, for those housing counselors in the 7th Council District, how each one of them is meeting their goals for whatever period of time they've had the contract? My reasoning for this is, we've had a lot of development in the 7th Council District. I can't seem to understand why they are not creating the pipeline for projects in the 7th, right? And those folks who do go through our housing counseling oftentimes don't tend to buy here, right? So we're promoting Turn the Key. The goal is to keep people who work here living here, right? I can't seem to understand why housing counselors, especially in districts like mine, right, where there's a lot of development, why are residents not the folks who are in the pipeline to be able to take advantage of those projects? Most of the time, or most often, there are folks that are coming from the outside who are able to take advantage of these types of programs. And so I want to know, how are my housing counselors, what is the work that they're doing, right? Who are the people that they are preparing to become homeowners? And what do we do differently if they're not from the neighborhood?
I think as far as stats and data are concerned, we'll definitely have to get back to you. We can look at that for each organization in your district. I'll just note that our Philly First Home program, which does involve the housing counseling agencies, and we can look at the 7th district specifically, but it does historically benefit folks. It ends up awarding applicants that tend to move close to their current residence. So that bodes well.
All right, I look forward to that information. Thank you. And then as it relates to, I guess we're going to hear at some point from Register of Wills, but as it relates to folks who have generationally lived in homes who are in dire need of repair, right? But they are the child of someone who has been deceased. The deed was never put in their name. There's no, what are we doing to kind of remove the barriers for folks to be able to take advantage and be able to stay in those homes if they're not the actual deed holder, but that home has been in their homes, in their family for generations?
The city has a history of providing support for Tangle Title, and through working with City Council and MPI funding, that's increased over the last few years, and we do have a robust network of partners that we work with to try and decrease issues related to Tangle Title.
If the city has a history of removing those barriers, I want to know where they are and how I can get them, because in districts like mine, I can't get them, right? I have a lot of families who are living in homes that are in dire need of services, and they can't seem to get the necessary support to be able to restore and repair their property because they're not the property owner. Their names are not on the deed. So if you have a list of what that is, or where they are, or where they can go, please share that with me as well. Thank you. Thank you, Council President.
And just to clarify, I think Mark mentioned a contract that was amended in October. That would have been 2023, not 2024.
So can you say it again? I'm sorry.
Mark earlier mentioned a housing counseling contract that was amended in October of 2024, although it was actually amended in October of 2023, obviously, because 2024 did not happen yet.
Okay. All right. Thank you. We're going to do a callback because we still have a lot of questions we want to do a deeper dive in, and so we'll be in contact with the administration on when that callback is going to be as we recess for the day to take care of additional business this evening. And so with that being said, the chair recognizes Councilmember Catherine Gilmore Richardson for a motion. Register of Wills also, for the record, will also be rescheduled to a future date as well. The chair recognizes Councilman Catherine Gilmore Richardson. Listen, our leader was throwing heat this morning. All y'all was throwing heat, and so, you know, we're doing our due diligence to make sure we fiscally sound and doing the people's business. And so if it take a little longer, I mean, we're getting it right as opposed to just skimming over things. And so with that being said, the chair recognizes Councilmember Catherine Gilmore Richardson for a motion to adjourn.
Yes, thank you so much again, Council President, for your latitude today, and to all of our colleagues. And with that, I move that City Council's Committee on the Whole stand in recess until until Monday, April 15th. I know it's today. We have a budget hearing this evening, correct?
That's just a town hall.
Thank you thank you so much for the clarification, Council President and colleagues. My apologies. With that, I move that Council's Committee on the Whole stands in recess until Tuesday, April 16th at 10 a.m. Thank you.
All those in favor signify by saying aye.
Aye.
Those opposed, the ayes have it, and we will stand in recess until tomorrow, April the 16th at 10 a.m.